Welcome to the Med Spa Minute, where every week we give you expert tips on what's new and hot at Luna Med Spa. I'm Jessica Hutchins, nurse practitioner and owner of Luna Med Spa. And this week, I just want to take a minute and talk about aesthetic nurse credentialing. Danielle and I just got back from San Diego. We went to iSpan last weekend. And for those of you who don't know what iSpan is, it is the International Society of Aesthetic and Plastic Surgical Nurses, and they put on a great conference every year. It's one of the most objectively non-biased, clinical-based conferences in aesthetics, in my opinion. And we love going every year, just bringing back pearls. And this week, when I was reflecting on what we, learned and who we interacted with, I just kept coming back to the credentialing point. And I think it's really important to talk about. So I'm going to just go with that. So we all know nursing school, you learn a little about a lot. It isn't really until you get into your career that you hone in and deep dive into a specialty. That's exactly what aesthetic nursing is. It's a specialty in nursing. It isn't just something that you can laterally move from, I've been an ER nurse for 20 years and I want to be an aesthetic nurse now. I'm going to open my own treatment room and start injecting Botox because it's easy. Okay, well, it's not easy, and it is a specialty, and it does take a lot of time, practice, and training to master your craft and also become certified, to be honest. So that's really important. So certification in aesthetic nursing, the only actual certification comes through iSpan, and it's called the CANS certification, C-A-N-S. You see it at the end of my name in my credentials, and it stands for Certified Aesthetic Nurse Specialist, and it's actually recognized by the Board of Nursing. It's the only aesthetic certification that's recognized by the nursing board. So keep that in mind when people say that they have a little certificate from a weekend Botox course. That is not a certification. That's just, they took a quick little training course. I take training courses all the time on everything constantly. And that's all aesthetic nurses that I know that are really, really good do too. You are constantly learning, growing, and changing everything to new techniques and ways to do things because everything is always changing. That's why we love aesthetic nursing. So in order to sit for the CANS and get this certification, you have to be in aesthetic nursing for 2 years working full-time under a dermatologist or a plastic surgeon. And it encompasses everything from lasers, injectables, skincare, radiofrequency. So it isn't required to be certified in aesthetic nursing. It just shows that you're proficient in everything offered in aesthetic nursing and that you can rest assured that you are in qualified hands. So just because somebody isn't certified in CANS doesn't mean that they're not qualified. Just keep that in mind. But I hate when people say that they're certified in aesthetics when they took a 1 weekend course class. That's just my biggest pet peeve in life, because I've invested so much time and money and trainings and education and everything, and everyone has. So it's just important to kind of know who you're seeing and what their background and experience is. And for those of you who are interested in getting into aesthetic nursing, my recommendation always is to start with Titan Aesthetics. It's Titan Aesthetics, and they're located in the Chicagoland area, and they are amazing. It's a program run by some of the best in the business, and they have offerings from everything from beginners to experts. So check them out. They're really well known and reputable in this field and industry, and if somebody applies here and doesn't have any experience, I will ask them and recommend that they invest in themselves and start there and then come back and reapply. Another thing you can also do is shadowing. You can ask some aesthetic injectors or aesthetic nurses that you know if you can shadow them, but don't be surprised if they say no, because a lot of aesthetic nurses are protective of their patients and the way they do things. A lot of things that we offer in this field are fee-based because we had to pay a lot of money to learn these skills. So if I'm going to teach somebody something, I'm going to charge you a fee. We're not a hospital. We're not a hospital system. And even when you're in the hospital, remember, you have to sign contract on contract on contract just to shadow in a hospital, because we also follow the same guidelines as far as HIPAA goes and patient privacy. So keep that in mind. We're not being mean or don't want everybody to join our industry. We just are being protective of our patients, of our practices, and of our time. So that is all I have this week for Med Spa Minute. Join us next week where we're going to talk more about collagen building treatments.